Clinical practice guidelines for the management of acute and chronic non-specific neck pain suggests a combination of exercise, education and manual therapy as the primary interventions. In this video, you will learn more about the evidence for these recommendations. The evidence supports the use of strengthening training and other exercises to reduce work-related neck pain, as well as chronic neck pain of non-specific or traumatic origin. However, no specific type of training or dose can be recommended based on the literature. One review found that manual therapy works best when combined with exercise or usual care rather than when it's used on its own. They also found that different types of manual therapy seem to be equally effective, which may indicate that the choice of techniques depend more on preference and less on the pain. Finally, there was strong evidence to support that manual therapy does not need to be focused on the painful or in the painful area to have effect. This was especially clear in the case of chronic pain. Another study reviewed the effectiveness of education as an intervention for non-specific neck pain. According to their results, education does not seem to be effective for acute or chronic neck pain as a standalone treatment. However, they found that the content of education differed substantially between the studies, from biomedical to contemporary pain science-based education, and that the results may not represent the effect of modern pain education approach, which is recommended by the guidelines. The evidence for cognitive behavioral therapy to manage chronic neck pain is sparse, but in comparable chronic pain conditions, it is now recommended as a primary intervention. And some evidence suggests that a combination of the above-mentioned therapies with cognitive behavioral therapy can be relevant for some people with neck pain. In summary, exercise can reduce neck pain and doesn't cost more than any other kind of therapy. For some patients, it could be relevant to combine exercise with manual therapy and education and possibly cognitive behavioral therapy. You can learn more about work-related pain from P4Work on Facebook and on YouTube.